tell us about this program. How broad is this going to be?
This program is going to be rolled out through the 5 regions, throughout the province. Today is a start, and what we are providing today are 2 simple things. It's to give people sanitizers just to make sure that at least they are protected in that sense, and to decontaminate the area around them. Yes, you can see the infrastructure is not that good, so that might be a breeding area for other ailments. So that's why we are in the program also of making sure that we decontaminate the area. But today, our main aim is to give them, this is too small, we give them 500 mils of sanitizers for them to use on a daily basis. We will refill them after 3 or 4 days just to make sure that at least in their immediate environment, they are protected against the COVID-19 virus.
The question might be, MEC, how many families here? We know hundreds of people live here in Alexandra. How many families are you going to distribute this to?
Today, it's everyone in this hostel, each and everyone in the hostel. The data that we have provided by themselves is that there's per room there's either 2 or 4 people living, including their children. So we have enough for all of them per head count, per family, per room. They will each get a 500 mils for the 3 days, and then we come back after 3 days, we refill them. But we also educate them on how to use it. It's not a soap to wash with. They have their own soaps. If they go out, then they can decontaminate their hands.
Then MEC, I mean, we know that we have a case here confirmed in Alexandra. We've got 9 people under quarantine.
Yes.
How do we then tell the people of Alexandra to say that we are with you during this time, perhaps even beyond the COVID-19? Because the notion is that it looks like government officials are only here during this outbreak.
Well, that's not necessarily the case. I think we need to be honest with the fact that it took a long time to upgrade the hostel. There are challenges that I'm not going to talk to right now, but what the municipality has done today, they're here. They just assured us with the MMC earlier on that they have a contractor in place who's going to remove, at least to declog this area. But the people must also help us. We plead with them that they help us to keep their area clean. It's not that bad, but it could be better. Yeah. It could be better. So we will work with them. We will educate them. And we're also going to be giving them buckets, by the way, the 20-liter buckets to keep with a message written outside that this is what we're supposed to do to help each other to keep the environment clean. We have other programs going forward as the department that will do, but today we are focusing mainly on the COVID-19 virus outbreak. Yeah. We want to flatten the curve. We want to help government to flatten the curve.
Yeah, I understand almost 70 sites set up to make sure that almost everyone in Johannesburg is getting tested, isn't it?
Yeah, the testing was done yesterday by the Premier and the MEC for Health. It was concentrated in the area where that gentleman was identified who had COVID-19, and the 9 people were then quarantined. But it doesn't mean that's the only area. The sites, like you said, those sites that are available, the minister will then publish the areas where they are, where people can go for testing. But we are also pleading with the community that they should be careful. They shouldn't flood the testing areas. It's when you have I think they have 4 main basic indications that a person might have COVID-19. Yeah, but there are sites that were identified by government. Yesterday it was an emergency. It had to be done because of that gentleman.
Perhaps just one last question, MEC, the dignity of the people that are getting tested. I'm not sure if you saw the picture yesterday, people being tested in public. I don't know if there was, some form of consent there. Okay. Are you thinking about this as government in Gauteng?
Yes, we are. Okay, I'm not the Minister of Health. I think is better placed to respond eloquently to that. But what I can say is that in our discussions as EXCO, the MEC for Health did mention the fact that they would observe their own protocols as the department. So if a person agrees that they be tested in that area, that's the only time that they will do it. So they respected those protocols. Yeah.
All right. Thanks so much for your time, MEC. And of course, Blaine, you'd recall that the picture that we saw yesterday, people being tested in public. But again, you would know that there is some stigma surrounding this particular virus, more especially people that tend to be tested positive, and when they come back in their community, then they would be shamed. And I think there has been a concern around that. But again, Blaine, people around here welcoming the intervention by government to really come through and actually respond to this particular concern of COVID-19, and making sure that in as much as they are congested in this hostel, at least something needs to be done, and that thing needs to be done now.
Makeketla, I mean, the Minister of International Relations yesterday, Dr. Naledi Pandor, was also commenting on the issue of stigma and saying that it has no place during this time, if not ever, in South Africa when we're dealing with this pandemic as well, because anybody can get it. It doesn't matter your race, your creed, your culture, where you come from, your background, rich, poor. We all can contract COVID-19. So it's a very important message that you're trying to get across there in terms of, rooting out stigma when dealing with this disease. Makeketla, as always, thank you very much indeed for your great reporting there. All right. As you heard from Makeketla, the Gauteng government is rolling out this province-wide sanitization solution program in its fight against COVID-19 as part of its ongoing efforts to help curb and combat the spread of the novel coronavirus. Human Settlements MEC